Okay, welcome to another edition of our Community Conversations podcast. I am your host today, Aliyah, UMA's Civic Engagement Specialist, and I'm joined today with some very, very special guests. So we can start with my right and introduce yourselves. Who are you and what do you do?
Hi, my name is Mariangeli Echevarria-Ramos. I am the Climate and Social Resilience Manager for Mystic River Watershed Association. We're an environmental organization working regionally in the Mystic River Watershed area, also including Malden. And I manage the Social Resilience Program, which is a fancy way to say that I manage projects that are helping community members and municipalities to get ready for extreme weather.
Hi, I'm Sharon Ron. I am the Assistant Director of the Public Health Team at the Metropolitan Area Planning Council, or MAPC. MAPC is the regional planning agency for the greater Boston area, which includes Malden as well as another 101 cities and towns. In the Public Health Department, we do work that bridges from local public health services to healthy community designs to doing work that's at the social roots, the social determinants of health, those root causes, and we have a focus on climate resilience. And so the work that we are doing and talking about today sits under that stream of work.
And I'm Chad Milando. I'm a research scientist at the Boston University School of Public Health, specifically in the Center for Climate and Health. My role on this and other projects is data analyst and researcher, investigating all forms of how the climate impacts or how the extreme weather impacts human health. So very excited to be here talking about our work over the past 2 years.
Yeah, I'm excited to have you guys here as well. So let's get right into it. And I'd like you guys to each kind of talk a little bit about what your organization did as part of this cool communications project, what you did specifically, a little bit more about the organization as a whole, and kind of how your work impacted our surrounding communities.
So I might kick it off by sort of explaining the umbrella of this project. MAPC got a 2-year grant from EEA, the Executive Office of Environmental Affairs, and we got that in partnership with the Mystic River Watershed Association, and our proposal was working with 5 cities in the lower Mystic area: Malden, Chelsea, Revere, Winthrop, and Everett. These were 3 communities that were urban heat islands known, and also were communities that had conversations about heat, but were trying to figure out how do we get our residents better prepared. MAPC, we work closely with municipal staff, with local governments, as well as community groups in our service area. But our role within this project was really to be the liaison between the local government staff on the ground and all the other partners on this project who are bringing their expertise.
Or MyRWA, that's short, we call Mystic River Watershed Association. Our role was co-managing the project with MAPC and also being the liaison with the community-based organizations and our community members that will involve in the process of this project. So coordinating that on the ground side of the communication strategy.
And the BU's role was sort of facilitating the data research and the analysis that we're supporting various elements of the Cool Communications project. So myself, along with Patricia Fabian and Greg Guilenius, sort of managed, obtained, and met the data, and then met with MyRWA and MAPC, weekly, sometimes more, to talk about which pieces of the analysis that we wanted to focus on and which would be most relevant to the communities we were working with.
Yeah, great. It's really awesome to hear your guys' perspectives on this and what your facet of work was. Because for me, I was mostly involved with some media creation and messaging around heat. So it's cool that, all the work that you guys did kind of informed the work I did. So it all kind of came down the chain.
And I was going to sort of speak to how we all were working together.
Yeah.
So the goal of this project was really, you're seeing by the fact that we have community-based groups, we have regional nonprofits, and we have academic institutions and government groups, that it was really a multi-sector response to an emerging threat in our region, which was extreme heat. And we were trying to pilot different ways to have a regional coordinated response to heat, recognizing that all of these organizations represent messengers in their community, but that there was no one who was putting together coordination, thinking through what is the messaging that we should be telling folks and when, and how does that change depending on who your community is, or who are the residents that you serve. So UMA serves a different group than MAPC stakeholders, so how does that affect the communication materials that we put out? And I really think that we entered this with more questions than answers. And so it was formatted as a 2-year pilot where we were hoping to try a lot of different things and hopefully with the BU data learn a little bit more of what heat impacts look like in our region and have that inform the work that we were doing. And then in year 2, take all that we learned and refine what we had created in year 1 and put together something that was hopefully ready for prime time across the region. And the region being either who MAPC serves or all the great organizations that MyRWA serves as well.
Yeah, so that's a great kind of explanation of what this whole project was. And I'm interested to find out from you guys a little bit, digging a little bit more deeper into what the work you actually did was. So, for example, Chad, what was it that you guys were trying to find out, and what were you hoping to do with your data collection and analysis?
Yeah, absolutely. I think a big motivation for us in this work, I think academia right now is really at a crossroads in terms of how it contributes to projects like this. Like, are people contributing in the abstract, or are we really working with stakeholders directly? So I think this project, the emphasis was really to be as responsive to the needs of MyRWA and MAPC as possible, while still pursuing sort of new research questions that would lead us, not just be repeating the same old things, but like what new questions and what new insights can we provide? And one of those questions that's kind of outstanding right now is the idea that we think that the main methods that we use to know how many people are affected by heat, just sort of typical heat surveillance, likely undercount how many people are actually impacted. So, right now the main methods of surveillance is just whoever goes into the ED, the emergency department, who the doctors say, oh, this person is really hot or suffering from heat stroke. That's the main mechanism that we have to say, such and such many people in Chelsea, in Malden, in Boston are affected by heat. And we actually think that that represents a very small slice of the total pie of people who are affected, because we know things like kidney disease and cardiovascular disease also increase during heat, but doctors don't necessarily tag it like that. And so our goal with this project was to try and provide the communities, as part of this project, a better estimate of the big picture, the total pie. So that's something we spent a lot of time on. We purchased data from the state to say, okay, what's the total picture of all ED visits? And then we used a bunch of different analytical techniques to say, okay, what's the fraction of these that change associated with weather overall? And that's kind of what we worked with MAPC and MyRWA on to say, okay, in Chelsea the number is this, and in Boston the number is this, and et cetera. So that's, I think, our day-to-day was really interpreting that. We had a lot of back and forth and conversations about, what does this number mean? Because it's a little abstract, right? If you're not looking at a specific code that a doctor put, like, what are you really looking at? And sort of teasing out that number and teasing out those conversations and saying, okay, what is a safe level? What is a not safe level? Those were some of the really important and interesting conversations that we had on the way in developing this report.
And if I can add, I think this was something that really came out of our local public health staff saying that they wanted and needed, that a lot of the research that had been either done at a national level or in hotter climates. And so a lot of our local public health staff were in the position where they're trying to make the case for heat being something that we need to take seriously within their own community. And having a data set like this helps them both doing that case making, that storytelling of no, heat's not just an Arizona problem, it's a Massachusetts problem as well. And also, I think there was a secondary set of questions about but what does that problem look like in Massachusetts? Are we seeing the same trends as we're seeing nationally in terms of who goes to the hospital and when? Or is there something different that's happening within our region, and hoping to use that information to then inform the public health strategies that they were putting in place?
Yeah, that's and I think that's kind of a great segue over to you, Mari, about more of the community-facing projects that you worked on and kind of what you saw on the ground.
Yeah. I think we had the data side, what public health workers are interested in investing in our communities. And from the MyRWA perspective, we were coming with the interest of how can we get the information to people? Something that we really see in our communities is that there is a gap on access to information and awareness of what services can you access in times of emergencies and also extreme heat that is just becoming more and more common every summer. And in 2019, we did an assessment, basically identifying what gaps were in the community. And one of the main things that came on was what Sharon mentioned earlier, which is that people want to have that information. They're trusting that someone is going to give you that information, especially our municipalities. But there may be gaps in capacity, and also not only gaps in capacity, but also how are you communicating that information? Is it accessible in terms of languages? Is something that is fun? Is something that is engaging for people to access and to learn? So as part of this project, we had a group of climate leaders and resident leaders from Mystic River Watershed Association and our municipalities that were involved in every step of the process on getting training on communications, identifying what kind of messaging was more appealing to them, and also disseminating these pilot strategies out there in the community. Another very important part of the project that I don't think we have mentioned yet is the participation of artists during this whole process. So we wanted to make sure that it's not just another Instagram post or Facebook post that goes to the community. So there were artists involved in creating installations and creating booklets and many resources for community members for them to be able to access this information in a very fun way. So that's a little bit of a snapshot of what we did with our community members. But I feel one main takeaway is that people want to see fun communications. They want to receive it on their website. They want to receive it in ways that may not be traditional, but it's something very important to reach our most vulnerable community members, as Chad was mentioning. And also they don't want to have information that is just sad and daunting. They want to have uplifting messaging around extreme heat.
And I would say that we started talking about this as building the culture of heat. We talked about Massachusetts as a area that has a really strong culture of cold, and that we were trying to build this culture of heat. And it was through this community-led work, this artist-led work, where it's trying to build the muscles to taking a hot day just as seriously as we would take a blizzard. As New Englanders, we know what to do when we see snow on the forecast, and we were trying to build the community conversation both within the municipal groups, so whether it's a local government staff or community groups, like what are they saying to the folks that they talk with and serve, but also within communities, like how are you talking to your neighbor about like, oh, it's going to be a scorcher tomorrow. Do you have your medication in hand? Do you have a place to cool down? Do you know where you're going to go during the heat of the day? Like trying to create that same sort of culture that you might have around cold, but around heat.
I think something that Sharon and others expressed to us a lot is this idea of message fatigue. People just like tired of hearing the same thing over and over and over again. And one of the questions that we wanted to investigate for the purpose of informing better messaging is, are the risks the same all the time? Like, does it matter? Is the first heat wave different than the second or the third? And, you know, in line with what other people have found, there's actually a difference. Like the first heat wave is more risky. Like you have a higher chance of going to the emergency room for a heat wave that happens in June versus something that happens in July and August. And what's maybe leading into a challenge is that there's some nuance to that, right? The first is worse in terms of risk, but from a systems perspective, if you're a hospital administrator, there are just more hot days in July and August, so you're going to get more people, even if the risk of any one individual one is lower. And sort of teasing out that it's higher sometimes, but not other times, and there's a higher volume sometimes than other times, that definitely, I think, is not... I think so often in this work, we're looking for these like silver bullet solutions where, you know, the answer is very clear and it's right there. But it's more often the case that there's nuance, right? And I think as sort of a combined team, we really worked hard to talk about uncertainty, to talk about nuance in a way that I'm, you know, very proud of. So I think that was definitely a challenge that we came up with. Another challenge, is thinking about this idea of like, what's a safe temperature, right? When you're just counting the number of people coming in for heat stress, you don't have to think about, what is the safe level. You're just saying, okay, you're just looking at the tallies, right? But for the type of question we're asking, when you're trying to say, okay, what's the total pie, like we were talking about before, you have to set some idea of what's safe. And that involved a lot of conversation for us. Like, is a day where it's 70 degrees safe, or is a day where it's 80 degrees safe? And that might differ depending on which, who you ask and what frame of mind they have. I think where we settled was, what are the risks when it's hotter than normal? I think that in terms of especially since this is a communication project, I think that's something that's easy to grasp. Like, oh, it feels hotter today than it normally does, or, so I think, the nuances with this were, some of the data challenges, but then also, how do we really make this actionable in terms of something we can put in a two-page or executive summary and that kind of thing. So, yeah.
Yeah, and I would say, sort of building off what Chad was reflecting, so a parallel process that was happening to this was that the Department of Public Health, right before our first pilot summer, released this new unhealthy heat tool, which was amazing. It provides a 7-day forecast and looks at the same sort of data set that BU had, but looks at only those hospitalizations that are noted as related to heat, so heat stroke and others, and put together almost like a air quality index of how unhealthy is this heat to you today. And I think there was a little bit of a challenge there of navigating of how is our project going to interface with this new tool. And I think this gets back to the idea that when we started this 3 years ago, there wasn't anyone really doing it. And there were a lot of people who were stepping into that space all at once. And I will say that the first year, one of the challenges was sort of built into the project being a pilot, is that we were trying things and they weren't necessarily working, to be fully frank. So one of the things that we decided to do when we learned that the DPH was putting out this unhealthy heat tool was that I would send out an email to all partners every week sharing the 7-day unhealthy heat forecast. And if there was unhealthy heat on the forecast, we were going to ask them to put something out there, whether it was at a community event, on their social media, in their email, what have you. And the summer kicked off with a real bang. We had a June heat wave that year, and it was really, really hot. And all of our municipalities put out information. And we were like, great, this method works, let's go. And then every single week after that, there was some sort of unhealthy heat event on the forecast. And that's when we sort of realized what Chad was speaking to of this heat level may be unhealthy for specific populations, but you're quickly running into messaging fatigue. If it's always an emergency, it's not an emergency. And the way that we were using the Department of Public Health's tool, which might have been very helpful from a healthcare provider's perspective of I'm going to expect a surge in hospitalizations related to heat today because it's hot outside and I'm going to prepare for that a week in advance, was not actually helpful from a public health messaging standpoint because it was just yelling at people all the time. It's really dangerous out. And honestly, from a person who grew up in Massachusetts, the kind of heat that we saw in that June event where it was 95 degrees and above consistently for several days feels a lot different than when it's 85 degrees and then it drops to 75 overnight. It feels different as a resident. And so if we were communicating the same at that 95 degree heat watch event at the same level of severity that we were talking about of when it's just generally hot, we were losing people. And so I think that was a real challenge that we learned almost immediately in that first summer, and then had to regroup and figure out how did we want to approach heat communications differently. And we landed on a place with all of we got together that fall and we asked our community-based organizations, we looked at the data and we asked the local public health departments, how should we do this differently? And we arrived on reflecting on this idea, first of the worst, that we were going to instead approach heat as in seasons. So we were going to make sure to have some sort of pre-season communication before it gets hot to let people know how to prepare for the summer. And then when that first heat wave is on the forecast, make sure that everyone is putting out information about where they can find local cooling resources and make sure that they are personally protected to the best that they can. And then over the summer, try some of those more exciting things like you were describing, the animations, the artist events, the community leaders, like engaging people where they are, but that relying that to sort of be your regular heat communications rather than expecting sort of emergency broadcasts all the time.
Yeah, I would say in line with that message fatigue, one big thing too was that even while changing those approaches, that comparing from the beginning of the project and later on in the project, I think something that we also saw is that the capacity, or basically the ability and the time of people to share this information, like our community-based organizations, are also residents, and seeing that you may be pushing a lot of information out there at some points, but also what is the capacity of our community organizations to share this information at different points, when a lot of the times community organizations are doing a very important labor, depending on what is their mission, to bring other services to community members, and how to have the time to share this climate change or extreme heat conversation that sometimes is hard to weave in the day-to-day of people, which is what we were also trying to do in some way in this project. And also our community members and our climate leaders, I feel that you go and do tabling, which is one of the activities that they were doing, but that's just like at specific moments of the month, of the year, in the summer. But thinking of how we can shift also from that to, again, creating that culture of care, culture of heat in the summer, where people know what to do, they can share it with their neighbor, and it's a little bit more natural to share those cool communications rather than all the time having to rely on a message, on an alert, or what the municipality sent, and it becomes more second nature. And also it takes a little bit more of the pressure of organizations that are doing other labor to have to fill that gap all the time.
I think this could be a good opportunity just to build on what Mari and Sharon were saying, to talk about our main findings as well, which, this nuance about first is worse, but also you see a larger volume later, so you need to start engaging with different media types like later on the summer was one of our big findings. The other was, the other two that I think we should highlight is that there is a lot of undercounting, or there's likely a lot of undercounting in the, surveillance methods versus what's the whole pie. And so, for communities who are looking to look at the whole pie, we've made our methods public, and anyone with a data set who wants to investigate this question can go to climatehealth.city and look at that. As another big output of this project was trying to enable other community stakeholder groups with data to do these type of analysis in a way that doesn't require making all of the iterations that we made along the way. I think we also, in terms of making things more second nature, like Mari was saying, I think Sharon, midway through the project, or at some point, you made this really nice distinction about, okay, what are we saying in terms of risk for individuals versus what are we saying for risks to organizations, and how does that change? And some of the individual populations at higher risk that we were consistently identifying were teenagers, people 5 to 17. I guess teenagers might not be the best definition for that. So yeah, but people
very
ages 5 to 7, very young teenagers. Hispanic populations and people on public health insurance all had elevated risk compared to, demographic counterparts. And I think, sort of thinking about the messaging, how we might affect messaging differently in for different community groups, I think was another important outcome for this.
Oh, that's great. It's really interesting to sit back and hear it from your guys' perspective, with you, Chad, and you, Mari, listening how the collaboration really came into effect. Because, we're all kind of, in this project, we are kind of separate. So now that I get to kind of sit here and talk with you guys, the full picture really comes into view. So I think that's amazing. And we're coming up on time a little bit. So my next question that I'm going to ask you guys is, now that the project is done, the campaign is over, what's next for you guys? How do we move forward from kind of what we learned these last 2 years?
Such a good question.
Yeah, I can maybe take a pass first. I mean, I think a lot of what's really exciting about this work for me is that I think it opens the door to a lot of future questions that can have very real world implications. So one thing that came up all the time in these meetings was, okay, let's take people aged 5 to 17. Like why is the risk higher among those groups? I mean, I know Sharon shared an article from another news source recently saying the opposite, and now we're talking about it. And I think, one question that has been on my mind since that meeting is, okay, how would we structure a research question such that we could, for the summer of 2027, be able to answer that question? So I think that's a big one on my mind is now that we've identified certain times, we frame a lot of our heat research work in like who, when, and where is the risk highest. And so I think this project was a great way to identify those regions of high risk or those places, populations. And I think the next step could be saying, what can we do about it? Now that we have some insights, and likely the answer is a lot of the same thing we've been doing, a combined, government, community, academic partnership that leverages both, quantitative statistics, but also in-person interviews and the mixed methods, qualitative, quantitative work that I think would make something really rich and powerful.
I would say from the community level, one of the big takeaways for us is how can we keep working in changing this culture of cool and storms in the winter towards being prepared in the summer, and especially for our community members, because we do a lot of extreme heat work. We do planting trees, we create cooling interventions outdoors, but it has been proven that if you have strong connections with your community, if people share information among each other, the likelihood of you being able to thrive and survive into extreme weather is way more high. So within MyRWA, we're making sure that we are rethinking some of our programs, our Climate Leaders program, or creating even new partnerships with healthcare where we can train community members in different tools that are actionable. How to help your neighbor sign up for, receiving help from the government to pay your bills, or how can you help a person with disabilities that is in your community, keep an eye on them and share some of the tips that you know for extreme heat, and thinking how they can receive that actionable tools and they can become that trusted person in their communities, in their building, helping each other out, and creating this concept that we're calling kind of like connected communities, making sure that you know who is there for you, and kind of like triggering that effect of changing the culture, rather than just focusing on the big intervention and trying to balance both, trying to balance the planning, which is very important for the long-term impacts and how we're going to be preparing the future, but also the tools that people have in the moment, and being able to use them too.
And I would say that our next steps, our findings, our lessons learned kind of build on both of these. I think that one of the things that was very powerful to me in doing this project was just how much I learned about the artists' work. That we didn't talk about that much today, but they piloted a whole bunch of prototypes for engaging people creatively in storytelling around heat in summer 2025. And it was elements of those prototype projects that really resonated with almost all of our community partners. And so for summer 2026, instead of going to a graphic design firm and asking them to create your stock social media posts that look really slick, we translated the artist's material and tried to bring what the artist did as one-time events or workshops and turn it into toolkits that our team has now been using to engage people around heat around the region. If you go to our MAPC Cool Communication Arts Toolbox, and we'll drop a link in the description, there is a library of all the materials that we've created that are now available to use to get people to talk about heat. So I think that I mentioned this because I think it bridges the two, because what came out of this was really the desire to say, if we know that it's older adults and it's young, the youth that are suffering worse on a hot day, how are we creating specific engagement methods that will reach them? It's saying that, you know what, in the last 3 years, we think we've built up a muscle of figuring out how to communicate to the general population. So now what we need to do is focus in on these populations who might not be connected to your city's newsletter, might not be going on Instagram, might not even be going to these community events. How are we reaching them? And I think it's through some of the more innovative work like Mari was describing in terms of partnering with healthcare providers. We're seeking funding to do work with childcare providers, informed by Chad's research to say we've seen that there is an uptick in risk amongst the young. How can we work with those who are taking care of them during the day to make sure that they're prepared for extreme heat? So I think it's like it is this element of like learning at the big and then starting to drill in on the smaller.
Yeah. Incredible stuff you guys have been doing. And I'm really glad that we've been able to sit down here and have this conversation together. I want to open up the floor to you guys to please share any last thoughts that you might have on our conversation and or the project, as well as how folks can contact you and or get involved to learn more about how to stay safe in rising heat.
Yeah, I think for Mystic River Watershed Association, not only in this communications project, but also we have a big presence doing extreme heat work and also in Malden. So if you're interested in getting involved in any community-led work for extreme heat and other climate change activities, you can go to mysticriver.org. We plug in there any callings that we're doing for resident leaders that want to be part of this work. You can receive our newsletter, and also more in general if you want to just become more involved and again creating this culture of like connecting with each other. We have many stewardship activities that you can go to our calendar and be part of that.
From MAPC side, we have all of the social media design packets and the artists-led toolkits available on our website at artsandplanning.mapc.org/Cool Communications Art Toolbox, or just search MAPC Cool Communications Art Toolbox. And I would encourage you to go there, take a look, and if you are interested in using any and all of these at your next community event, let us know and we will hook you up. If you are interested in doing a project around heat resilience, climate resilience, or just talking to us about what your municipality might be doing right now, send me an email. My name is Sharon Ron. That's SRON @mapc.org, and I'm always happy to talk climate and heat resilience with you.
For this work, all of our analysis is contained in a white paper that's included in the MAPC toolbox. You can find that work there. All the analytical methods are open source in an R package, which you can find at climatehealth.city. And you can follow more of BU's climate work at the Center for Climate Health.
On the UMA side, if you guys are interested in some of the work that we did here, you can go on this YouTube page and find the playlist containing all of our heat-related messaging from the last 2 years, containing some of the artist work as well as some of the interviews that we did with folks sharing their stories. You can also find it on the MAPC page as well. All of this information will be available with links in the description below, so please check that out if you're interested in learning more. Yeah, thanks for listening, and thank you guys for joining.
Thank you.
Thank you so much.
Bye.